All right, so we're going to be doing a really cool procedure that I'm going to introduce in my practice called like a river modeling technique, and I'm calling it Corset Contour. So the idea is we want to get a more of a tighter waistline, and so anatomically we have this limitation of our lower rib cage. And so what we're doing is I'm making very precise fractures of the lower ribs, T11, T12, in fractional, and then now we're able to get a smaller waistline. So the women who wear like waist trainers a lot or always trying to get their waist smaller, this is the perfect procedure for this because it's a permanent waist trainer effect. Super cool. Going through the procedure, we're going to do real quick is we're going to do an ultrasound. It's ultrasound. Guided marking of the ribs, so they're going to be T11 and T12. The dark shadow is going to the bone, and then there's two. This is 11, this is 12. They're floating ribs, are not attached to the chondral skeleton of the upper ribs, and so they're the ones that kind of control the width of the waistline. And so I'm marking them out with ultrasound, and then the next part of the procedure is making an incision between those two ribs, and I get down to the soft tissue, find those bones, and then I'm going to slowly just kind of scrape off what's called the perios, this outer tough layer of the bone, and then make sure I'm at the level where I want it to be, which is it's about 7 centimeters from the midline. And then I use a piezotomy, which is a ultrasonic scalpel, which is only going to cut hard things. It doesn't cut soft tissue. It doesn't cut muscle, doesn't cut anything else other than anything hard. You have to put pressure to it to make it cut. So it's a very controlled corticotomy. That's what the word is. It's going to be a controlled fracture of the outer surface of that rib. And then with a little gentle pressure on the end of the rib, I'm able to fracture it completely.
Oh, there you go.
Yeah. And then you have two pieces that are completely fractured. On the undersurface, we still have all the internal fascial support, so there's no puncture on underlying soft tissue. So go for T12 first, and then slide up to T11, and then make sure it's within the line of latissimus dorsi, so we get a nice natural waistline contour. Closure is pretty simple. Just kind of bring the soft tissue back together. Two small incisions, 1.5 centimeters in length, and we put them into a binder right out of surgery, and then tomorrow she's going to get it into a corset, which is going to be a cast. That's what we're going to be using as a cast to mold that waistline into a smaller form as the rib heals and then reconstitutes. I think it's going to be a game changer for women who feel like they have a little more of a straighter waistline, and despite all the waist training and all the liposuction they've had done, they're able to get this permanent waist training effect. So, Corset Contour. Excited to bring it to the practice. I think it's going to be the new big thing, and I always preach safety first. You know, the technique, the approach, and then as well as the entire surgical team that I'm able to do the procedure with. So that's it. And if you're interested, let me know. Send us a message, and stay tuned for the videos and even more information and frequently asked questions about this procedure.